Hello, everybody. I see we are at the top of the hour, so I want to get us started with just before we begin with our main content for this first Virtual Partners Forum, number one. I just have housekeeping. My name is Sarah Crass, and I am one of the members of the Virtual Partners Forum team. We're so excited to have you here. Thank you for participating today. My friend Christy Yerk is all helping with audio troubles, any technical issues, so she'll be looking. If you're having any trouble participating, please reach out to Christy. Hopefully, most of you are all connected via audio there. You will notice that when you join today's webinar, you are automatically put on mute. We just ask that you please remain muted throughout the call because this helps bring the background noise down to a minimum so that it doesn't interrupt our presenters as they are going through their presentations. While you are muted, we don't want you to be silent. Please utilize our chat box. As you see down in the chat box, we have a few people already starting to put in where introducing themselves. Please use this chat box to ask your questions and make your comments during and throughout each of the presentations. When we get to our Q&A portion of the webinar, we will be starting with those. We will be looking for the questions within the chat box. So that is how you submit your questions for our presenters today. Sheila, over to you. Sheila is my partner in the Virtual Partners Forum. Go ahead. Start when you are ready with our introduction of this series.
Greetings, everyone, and welcome to the very first event of the Virtual Partners Forum. This is the first time that we are organizing a Virtual Partners Forum alongside the Partners Forum that will be held in Delhi next month. We've organized a few different events, two that are in the lead up to the forum, the webinar series and the virtual side events, and two that will happen during the forum, which are the live streaming and a chance to get to know the panelists. You can find more information about all of these on the website, partnersforum2018.com, and you can click on Virtual Forum to find out more. I'll say a bit about the virtual side events because this is really your chance to organize something. There are different themes that are happening as part of the Partners Forum, and this is your chance to say, we want to get involved. You may not be able to join us in Delhi, but you may have something that you want to share or do ahead of time, be that a hashtag takeover, a webinar, an Instagram competition, anything you would like to organize ahead of time that speaks to the themes of the Partners Forum. You'll find instructions on the website on how to send us the details on what you're organizing, and we'll happily promote that for you. The webinar series, there are 5 in all, and 4 of the 5 are organized around the themes of the Partners Forum. And the last one is an opportunity to get to know more about PMNCH and what will be coming in the next few years. Each of the plenaries or each of the themes of the Partners Forum have a working group, and the co-chairs of these working groups have put together these webinars. So the theme today is on multisectoral collaboration. If you have signed up for this webinar, you do not need to sign up for any of the other webinars. You will get updates automatically with the dates and times and login links for all the other webinars. And we also want to really acknowledge World Vision International for coming on board and helping us on so many different ways to put together this webinar series, and particularly for being our technical arm to host this today. So on to our first webinar. As I said, this is the theme of multisectoral collaboration. And we have both of our co-chairs on the line today, Asha George, who's professor at School of Public Health, University of Western Cape, and then Maureen Sams-Vaughan, professor, University of West Indies. I'm going to say a little bit more about Maureen before I hand it over. Maureen will take us through the rest of the program. But just so we know a little bit more about Maureen, she is a professor of child health, child development, and behavior at the University of the West Indies, a development consultant and behavioral pediatrician. She's also the first chair of Jamaica's Early Childhood Commission. in which she led the transformation of Jamaica's early childhood sector through the development and implementation of the first cross-sectoral national strategic plan for ECD in Jamaica. She is an advocate for vulnerable children, particularly those in the early childhood age group, children with disabilities, and those impacted by violence, and has published significant research in these areas. Her research has influenced public policy in the areas of parenting, early childhood development, mitigation of exposure to violence, and the development of early childhood indicators. So I'm going to hand over to Maureen, who will tell us a bit more about what this theme is all about in the Partners Forum and who we will be getting to know today. Do submit your questions through the chat. We'll have a chance to answer some of those at the end. And just know that the questions that you ask today, even if they don't get answered, they are really helping us fine-tune the conversations that we'll be having at the forum. So this is a chance to make sure that we're hearing what you have to say and for us to learn about what's on your mind so we can make sure that the Partners Forum is as meaningful for everybody involved. So Maureen, over to you.
Thank you, Sheila. Today, we are going to be doing a webinar on multisectoral collaboration. The SDGs, these numerous SDGs, all require multisectoral collaboration in order for us to really move them ahead. They re-emphasize how critical it is for health and sustainable development goals. So what we're going to be exploring in this webinar is how is multisectoral collaboration most effective, what factors enable it to contribute to transformative change. We're going to explore these questions, and through the three presentations, we're going to provide fresh insights into how partners work better together across sectors to achieve shared goals. We will hear about cross-cutting learning, and it will give us an introduction to the forthcoming supplement in the BMJ that's going to be showcasing successful multisectoral collaboration across 6 priority areas. So I'm now going to introduce our 3 speakers. The first speaker is going to be Rachel Hinton. Rachel will tell us a little bit more about the success factors case studies, the ones that are going to be released at the Partners Forum in December. Rachel is a technical officer at the Partnership for Maternal, Newborn and Child Health based in Geneva. She is the coordinator of the multisectoral collaboration study, which has involved working with 12 country teams to develop country case studies on what makes multisectoral collaboration work. She also leads the empowerment portfolio of work at PMNCH. Rachel has a background in participatory and mixed methods research, knowledge translation, and policy analysis in the health and development fields. Prior to joining PMNCH, Rachel worked at the Menzies School of Health Research in Australia as a senior researcher in the Indigenous Health and Wellbeing Program. She also lived and worked in Papua New Guinea for close to a decade, where her research, program, and policy work included a focus on women's, children's, and adolescent health and peace building and conflict reduction. Rachel has a PhD in international health and a master's in social science with a focus on anthropology. Immediately following Rachel, we will hear from Ida, who will be speaking on competing frames for intersectoral action. Now, we all know, if we've tried intersectoral action, that sometimes we have competing interests. Ida is going to delve into this a little more closely, particularly the area of the first 1,000 days of life. And is well set to do this. She's a PhD candidate at the University of the Western Cape in South Africa, with prior training in pharmacy. Her PhD study draws attention to the process of intersectoral collaboration during the early stages of policy formulation and implementation using the Western Province's first 1,000 Days Initiative in South Africa as a case study. As part of the document review for her PhD study, her presentation will focus on competing ideas, sometimes called competing frames, during the formulation of the first 1,000 Days Initiative, and she will discuss this impact on intersectoral action. Well, we all know that multisectoral collaboration requires some coordination and some governance, so we will end with Sarah Bennett, who will speak on multisectoral governance. Sarah is Professor and Director of Health Systems within the Department of International Health at the Johns Hopkins School of Public Health. Her background is in politics and economics, and she has a broad interest in health systems. One of her current interests is the governance of multisectoral action. She convened the Bellagio meeting on multisectoral governance and co-leads the forthcoming BMG Global Health Supplement on the topic. She is the former chair of Health Systems Global, a former director of the Alliance for Health Policy and Systems, and current chair of the Joint Health Systems Research Committee. Each one of our speakers will speak for 15 minutes, after which we will move into a question and answer session. So, over to you, Rachel.
Great. Thank you very much, Maureen, for the kind introduction, and hello to everyone joining us today. It's a great pleasure to be here to discuss what makes multisectorial collaboration work and the series of studies that we've been working on with partners over the past year. So, you know, this, where did this come from? Where did the country series, country case study series, evolve from? So it all really started around in building on work that was conducted in 2014, which shows that the Success Factors series of studies for women, children, and adolescents' health, as well as other studies, found that during the years of the Millennium Development Goals, sectors beyond health contributed to around 50% of reductions in child and maternal mortality that was achieved in low and middle income settings and countries. So this work really showed that countries' health and development outcomes were improved by health and other sectors acting independently, but also there were other improvements were achieved by intentional, conscious, multisectorial collaboration. So we really know that outcomes in areas such as education and nutrition and water sanitation, etc., really do contribute to improved health and vice versa. And we know that the value that progress in a range of sectors can bring to efforts to achieve health and development goals. And this is really well recognized. But, Maureen did mention the Sustainable Development Goals. And so to achieve this, we really need to know a bit more. We need to know when is multisectorial collaboration most effective and what factors do enable multisectorial collaboration to contribute to transformative change. And it's these kind of questions that we were looking to answer. How did we go about this? So at the beginning of December 2017, PMNCH issued a global call for proposals. And we were seeking inspirational examples of collaborations across sectors designed to improve women's, children, and adolescents' health and health and sustainable development more broadly, and to look at what were the lessons and what could be learned from successes, but also importantly as well as the challenges and potential failures. Just trying to move my slide. There we go. So what were we looking for with this global call for proposals? Well, we were looking for multisectorial collaborations from any country. So it could be high, middle, or low income countries. The collaboration could be led by a health sector or driven by another sector with health as a partner. It could be government-led, or it could be led by other partners with government as a partner in the collaboration. And it also had to address one of the 6 Every Woman, Every Child priority areas, which I'll briefly just name for you if you don't know them, which was sexual and reproductive health and rights, adolescent health and well-being, the empowerment of women, girls, and communities, early childhood development, quality, equity, dignity of care, and humanitarian and fragile settings. So we were looking for proposals that were covering these themes and that were multisectorial collaborations. So what were the results? Well, we were bombarded with some extremely interesting proposals. We received over 300 proposals that were submitted, and all of them, they were reviewed, and there was a short list drawn up based on a range of different criteria. And the expert review process was undertaken by a range of different representatives from different constituencies, including the UN, academics, NGOs, adolescents and youth, etc. So covering the broad range of the areas which we were looking at as well. 12 proposals were selected for development as a case study, and there was key criteria that the selection process was based around. So very briefly, we wanted to see if there was evidence of success, whether it could be around the process of the collaboration or whether there was impact of success across different dimensions such as policy and service outputs, health and sustainable development, as well as others. We wanted to see that the collaboration was already well established and potentially could be scaled up or had already been scaled up. We wanted existing data and documentation, so the availability of data sources to inform the case study, issues covered like innovation. There were other criteria related to human rights, gender equality and equity. So that was just to give you a brief idea around the criteria for those that were selected. And of course, we also had a global steering committee that was made up of 13 health and development partners. And they were co-chaired by Sharma Kuravilla from the World Health Organization and Wendy Graham from London School of Hygiene and Tropical Medicine. And they really, the committee was able to provide strategic direction and editorial oversight for the case study development process. So what were the case studies that were chosen? Here they are here very briefly, and we won't go into too much detail, but it just gives you an idea of across the 6 themes, the range and diversity of the different case studies that were selected, from high-income countries from South Africa, USA and Chile and Germany, to other countries such as Indonesia, looking at essential nutrition interventions, in Guatemala, looking around the empowerment of women, girls and communities, looking at the monitoring of health services. All this information is available and on our website as well, and I encourage you to look them up specifically. So just to give a very bit of brief background on the methods. So these methods that were used really did build on the first success factors study that I mentioned earlier that took place in 2014. We also used a case study approach because we were able to draw on both qualitative and quantitative data to really tell the story of the how and the why of multisectorial action and collaboration. So the case studies were developed in 4 phases. It started off with an evidence review and looking at the factors that influence successful collaboration across sectors. And we also developed a conceptual framework based on this literature review, and which formed the basis for the methods guide that was developed to inform the case study development process. And the link to that methods guide and all the information on the process and methods to develop the case studies are at the link there. And I also hope you have some time to look at that later. So the call for proposals, which I've already mentioned, took place at the same time as phase 1. And once the countries were, the successful proposals were selected, country teams then came together to develop the country case studies. And they established a working group which really conducted the analysis of the main factors leading to the collaboration or of what worked in their context or otherwise. So there was a data collection process, there was interviewing of key stakeholders, and importantly, country teams also conducted a multi-stakeholder dialogue where the findings from the data collection process were reviewed. The final phase was synthesis and dissemination, which I'll talk a little bit about later as well, which was the write-up of the learnings for publication of the case study. So how did the teams develop the case study? As I already said, there was the established country teams were supported by international consultants as well as national consultants. The PMNCH Secretariat supported with coordination across the 12, and we had oversight by the Global Steering Committee. So the country process, the country teams led on document and data review and stakeholder interviews. And importantly, as I mentioned, there were country multi-stakeholder dialogues where, which brought together stakeholders from a range of different sectors. There were face-to-face meetings where stakeholders were able to really discuss the collaboration, what was the key findings. They could discuss them together and agree or disagree of what was coming out of that, and take the learnings forward into a publication. So the outputs for the multi-stakeholder dialogue, combined with the document and data review, informed the development of a 3,000-word article, which was on what worked and what were the challenges for undertaking multisectoral collaboration in their specific context and the program under consideration. The articles were submitted to the BMJ and as part of a rigorous peer review process, and to be published on both online and as a supplement in time for the forum, which will be on the 12th and 13th of December, as already mentioned. So it was quite a process. And so the question is, it was, you know, a lot of people involved. There was a lot of work to do within quite a tight time frame. So did everything go to plan? The process really did require, you know, adaptability and persistence and understanding of the context, which really did influence, as we know in many things we do, you know, the program, or in this case the case study development process. So some country teams faced environmental challenges, such as there was a volcano, which obviously impeded on the way in which stakeholders were able to come together or go and meet others as part of the collaboration process. In other countries, there was a changing political landscape with elections being held. So there's a lot of discussion around when and how the work or the case study development process should go ahead in time or before or after the elections to ensure important stakeholders were able to be a part of the process. In other cases, the program had evolved since the proposal had been submitted. So, for example, it was, you know, difficult in some cases to bring stakeholders together because in some examples they had moved on to other things, and it meant being a bit adaptive and adapting to the context, to even having to reach out to stakeholders who'd moved to other countries to try and get their input on the collaboration and to get their perspective and different view on what worked and also what were the challenges. And of course, what most importantly was that you know, the authors of these case studies and the country teams really undertook a huge amount of work to develop the working papers that informed the multi-stakeholder dialogues, the journal drafting the journal articles, responding to editorial and peer review comments as part of submitting these papers to an academic journal. So, you know, a very intense period of writing and you know, for many of us, rewriting took place between June and October this year, and reflects the time and commitment of the country teams and partners to this learning process that was also supported by the international consultants, the PMNCH Secretariat, and of course the steering committee. So how many partners contributed and how will the lessons be shared across countries? So a huge number of partners participated, with over 500 national partners involved in the development of the case studies across the 12 countries. It really did enable South-South learning, encapsulated in a diverse series of public goods from the BMJ series, which includes an overarching synthesis paper of the key findings across the 12 papers, as well as the 12 country studies themselves. There will, of course, be discussions at the Partners Forum, on social media, and obviously this discussion we're having today as well. And after the forum, there's obviously opportunities for further learning and sharing among PMNCH constituencies for further action. Very quickly, what will be in the BMJ series? There will be an editorial We have 2 opinion pieces, a political commitment perspective and also an opinion piece on the value add of multisectoral collaboration. We have the multisectoral collaboration country case studies, the synthesis paper, as I mentioned, and it will be in open access online, and it'll also be available in print at the forum, and of course accompanying social media, etc. So we're really hoping when it's launched, please do seek it out, and we can tell you more at the forum. What were the clues for success? We have a short film, which is, here's the screenshot of it, as well as plenary 2 at the forum on multisectoral collaboration, and a range of different concurrent sections will give further insight into the findings of across the case studies, but also the specific case studies themselves. So we're really looking forward to those discussions at the Partners Forum. For more information, please do go ahead and look at the PMNCH website for more information on the studies. And of course, the BMJ supplement, when it's published in the first week of December, you'll be able to see the papers online. And obviously, more discussion will be held at the Partners Forum. And thank you, and we look forward to engaging with you further at the Partners Forum and beyond. Thank you.
Thank you.
Now pass on to my colleague Ida, who will be presenting today, as Maureen said, on feeding ideas during the formulation of the first 1,000 Days Initiative in the Western Cape Province, South Africa. So Ida, over to you.
A bit of some background concepts, and to highlight that the literature which has examined a lot of the collaborative governance frameworks paints this picture that collaboration is really a process. And during this process, there is an emphasis that in order for stakeholders to effectively address a particular problem or a situation, they need to be able to develop some kind of shared understanding of what they can collectively achieve together. But as you can imagine, and as Maureen mentioned, achieving a shared vision across stakeholders who have very variable interests is a challenge that most collaborative processes face. And so in a lot of the collaborative governance literature, this idea of a shared understanding or a shared vision is really just one factor among a range of variable other components that contribute to how collaborative processes unfold. But for this particular presentation, I'll be talking about achieving a shared vision and some of the constraints towards that. So intersectoral action is often advocated as an approach to address a lot of social determinants of health, which are otherwise known as wicked societal problems. But it's important for us to acknowledge that addressing social determinants of health themselves often have unclear boundaries and very uncertain policy direction options. And within this context, it becomes crucial to have a shared vision, because for the policy to advance and to reach towards implementation, it's important for there to be agreement between what the problem is and what the solutions will be. And so for this presentation, I'm proposing that there's a role that framing plays during the conditions of uncertainty. And just to set the tone for the rest of the presentation, frames are defined as cognitive maps through which meaning is structured and expressed. And frames become quite influential in policy making because they shape how actors view the world, but they also assist in generating discourses about what needs to be done. So if you think about framing in policy processes, they focus your attention on a particular solution, but at the same time, they divert your attention from any other solutions that may be available. And so let me just introduce the context that I'll be talking about today. So the first 1,000 days refers to the period between conception and 2 years of life. And it's received increasing attention because of this idea that if we offer a multisectoral intervention package, it can provide sustained benefits to early childhood development. And so with that knowledge, the first 1,000 days was launched in the Western Cape province, and there was an aim to address three main factors. So that was nutrition and health, nurturing care and support of caregivers, and the safety, protection, and stimulation of children. And what was quite interesting for me about the first 1,000 days is that it demanded an intersectoral focus, and it was quite early in the stages of policy making. And so for my PhD, I was interested in using the first 1,000 days to try and understand how intersectoral collaboration is initiated and then how it unfolds as it moves towards implementation. And so what I'm presenting today is really just the first part of that study, where we wanted to explore how policy ideas are framed and also identify whether that framing has an impact on achieving a shared vision. And we used policies or policy-related documents because we wanted to unpack what written text implies about underlying values, ideas, or meanings. And so for our document review and analysis, we were informed by key informants who were in the process of formulating the first 1,000 days. And there was an interesting range of documents from global settings to the national and to the subnational level. What we were also interested in is trying to trace how the first 1,000 days was prioritized over a period of time across different sectors. But what we found was that they were largely health sector and early childhood related documents. And so for the analysis process, because we were interested in concepts of ideas, framing, and argumentation, we used a deductive code that was informed by the Schmidt framework, which basically talks about ideas as policy solutions, ideas as problem definitions, and ideas as worldviews. But more than that, we were also quite intrigued by the rationales that were proposed for focusing on the first 1,000 days, as well as the discourse that policies articulated about intersectoral collaboration. And so during later stages of our analysis, we really sought to understand how the policy ideas reflected about how intersectoral collaboration is understood. So this is a very busy slide, but there's just two things that I want to highlight here. So there's a whole lot of arrows going down, and those arrows represent policy ideas or the flow of ideas. So what was quite intriguing was the fact that policy ideas come from global moments, and they sort of have this trickling effect where they end up at the national setting and later on at subnational level. And usually they don't find an empty vacuum, so they also intersect with ideas that are present at subnational level. And for me, what was quite interesting was this convergence point of these global ideas as well as policy moments at the subnational level. And what was quite important to also think about is the fact that when these global moments are shaped, they're usually quite broad, and once they land onto the subnational level, they then have to be conceptualized into a concrete plan or a concrete strategy. And so for this presentation, competing frames really emerged at the subnational level, which is what I'll discuss in the next slide. So what we found across the policy documents was that there was agreement that there's a desperate need to focus on the first 1,000 days. But what intrigued us was how the problem to be addressed within the first 1,000 days was framed quite differently. And this slide has outlined three of the problem definitions. So the first problem definition was where the first 1,000 days was articulated as being a maternal and child health mortality problem. And this argument was mainly supported by the child survival focus of the MDGs, as well as the fact that the health sector was viewed as being responsible for women and children during this period of life. And so many of the policy solutions that were advocated proposed very specific clinical guidelines that emphasize clinical governance or the training of health workers. And the second problem definition was articulating the first 1,000 days as an early childhood development problem. And really, the argument that was used to support this definition was largely the experiences that have been documented about fragmented and poor quality early childhood development services. And so policy programs really sought to promote this notion of trying to stretch traditional health services to include other ideas from different sectors. So for example, supporting of parents or introducing early stimulation to children. Then the last problem definition worked at a more broader level compared to the first two, and really described the first 1,000 days as an indication of the need to focus on social determinants of health. And so concepts such as early life influences were viewed as revitalizing the impact of social disparities. And so this problem definition really pushed for the involvement of the broader society, including government sectors, in trying to address social determinants of health. And so if you were to stand back and think, well, what does this mean in terms of intersectoral collaboration? And what does this mean in terms of the first 1,000 days moving forward? And what we propose in our presentation is that these policy solutions reflect that there are three ways that people engage with intersectoral collaboration. The first is programs that are focused primarily within the health sector. And the second is this interface level where programs may be focused within the health sector, but try and include ideas from other sectors. So examples such as home opportunities to learn or promoting early stimulation are some of them. And then there's this more general level or wider level where collaborative arrangements try to promote a shift in how sectors relate not only to each other, but to the broader society in trying to address social determinants of health. And so considering the floating range of competing policy solutions within one intervention, I think the question we have to ask ourselves is what impact does it have on policy making or policy development when there is a common agreement on the issue but very different ways of addressing it? And it's almost as if actors are speaking across each other. And although we were able to unpack some of these frames through written text, the next step of the research, will really seek to identify what happens when actors have to navigate or negotiate through these problem definitions, which definitions win and why, and what impact does that have on intersectoral initiatives such as the first 1,000 days. And this will be later explored through interviews and continuous observation. And so the question I would like to end the presentation with is, considering the importance of initiatives such as the first 1,000 days, especially in the SDG era, how do we navigate different problem definitions at an early stage of policy making, which have a huge impact on how policies not only get developed, but how they get implemented? Thank you very much. And I'll now hand over to Sarah Bennett.
Thank you very much indeed, Ida, and good morning or good afternoon or good evening to everyone online. I'm going to be talking today about a supplement that Kumanan Rasanathan and I worked on, and was actually published in BMJ Global Health last month. And it started with the Bellagio meeting, as Maureen described, a couple of years ago now. And I think that there were a couple of prompts for that initial meeting. And firstly, we thought that multisectoral collaboration was really fundamentally about governance. It's about managing diverse interests. They may be competing interests, they may be overlapping interests, but at its heart, in order to get multisectoral collaboration to work, it's a sort of governance challenge. And I think the second prompt for the meeting that we held was a recognition that outside of the health sector, there's actually quite a diverse and rich literature around governance and collaboration, public administration, and how we set up sort of mechanisms to promote better multisectoral collaboration. So we were really interested in trying to draw on some of that literature outside of health and think about how it could be applied to health. So what I'm hoping to do in today's presentation is really draw upon a number of the different papers in the supplement to talk a little bit about what is multisectoral governance for health, why it has proven so difficult to govern multisectoral collaborations, and to talk a little bit about some promising strategies for strengthening governance, as well as sort of what else do we need to know, perhaps a nascent research agenda moving forward. So this definition that I have comes from a recent paper by Evelyn Deleu. And it's also a paper focused around multisectoral governance, and she describes it as the sum of the many ways in which individuals and institutions, public and private, manage the connections of their common affairs. It is a continuing process through which conflicting or diverse interests may be accommodated and cooperative action may be taken. And although this definition didn't exist at the time that we started work on this supplement, I think it matches very closely the kind of thinking and ideas that we had. We started out by thinking about multisectoral or intersectoral governance as governance across different functional sectors. So how do we ensure that health works and plays better with education, with trade and industry, with environment, with animal health? But actually, I think the more we dove into the literature and the kind of problems in the field, we recognized that we also needed to think about public and private divides, the many ways in which the world in which we live sort of lives in silos, and in order to be effective, we need to manage across those silos. As I alluded to earlier, I think that there's actually a lot of different bodies of theory and research outside of health, which is relevant to this question of multisectoral governance. So I could point to public administration as being one, and certainly in high-income countries, over the past 15 to 20 years, there has been a rich literature that has involved, sometimes sort of referred to as joined-up governance, collaborative governance, which is looking at different ways of governing across different sectors. I think even in the health sector, our understanding of what governance is and why it matters has been enriched during the past 10 to 15 years. And also, Kuman and I were very interested in sort of notions of political economy, recognizing that frequently when we're talking about challenges to multisectoral governance, there's a political element to them. So in terms of framing this particular presentation, I wanted to draw upon a very simple political economy framework that talks about interests, namely what are the motivations of different actors to engage with a particular issue, what is the relative power and the sources of power that they can draw upon when they're focusing upon this particular issue. Secondly, this framework talks about institutions. And to flesh that out a little bit more, by institutions we mean the broader legal contexts, the bureaucratic arrangements, questions around organizational capacity, and how collectively these influence the possibilities for multisectoral collaboration. And thirdly, and Ida has actually provided you with a really nice introduction to this sort of third dimension of the framework, ideas, i.e. alternative ways of framing societal problems, policy solutions, and the evidence that supports them, and in particular, the likelihood of identifying common goals. So in the next few slides, I'm going to walk through these different dimensions in interests, institutions, and ideas as a way of outlining some of the common challenges to multisectoral collaboration in low and middle income country contexts. So starting with interests, I think that there's a big question we need to ask about who is seeking to put this issue, this multisectoral issue, onto the agenda and why. And when are they successful in doing so? Or when are we successful in moving forward multisectoral collaborations? And if you look at the sort of literature within health, I think it often points to high-level political leadership as being the key to sort of getting a successful multisectoral collaboration going. And I wouldn't dispute the importance of high-level political leadership at all, but I also find it a somewhat sort of frustrating answer, in the sense that it's very difficult to drum up high-level political leadership, and frequently high-level political leadership is the product of other strategies and activities. So to point to one of the papers in the BMJ Global Health Supplement that we published was lead authored by Shayla Zaidi, and it was really a comparative analysis of early childhood development and nutrition in Pakistan, and seeking to explain why nutrition actually has a lot of traction both in terms of the policy agenda and implementation, whereas early childhood development has languished more. And Shayla's paper provides a number of different answers to why one of these issues has got traction and the other hasn't. But for nutrition, she points to the fact that there was kind of a window of opportunity that was created by high-level political leadership, but it was also the product of extensive coordinated advocacy and consistent investment in policy networks and advocacy networks that allowed the nutrition agenda to really take off in Pakistan. So I think there's much more that we need to do and understand about how policy networks support the progression of a multisectoral collaboration. Sometimes, however, I think we find that interests may be in opposition to each other. They may be competing or conflicting interests. And so I think it's really important that we seek to understand more the extent to which interests in a multisectoral issue are aligned, i.e. everyone is on the same page, the extent to which they're diverse, meaning they're not aligned but they're not in direct competition, or the extent to which those interests are actually opposing each other. And in the supplement, we provide one particular example, which is around asbestos in Thailand. And it's a paper lead authored by Chernratai Kanchana Chitra and colleagues. And they talk about how the Thai government passed a ban on asbestos, but then they describe the immense difficulties in terms of implementing that ban, largely due to competing interests in industry, powerful industrial interests that oppose the implementation of that ban. So I think that it's very important that when we're looking at multisectoral collaboration, to understand how interests are aligned or not, and to develop strategies for managing those interests depending on the extent to which interests are aligned. Finally, if you look at some of the collaborative governance literature, and Ida referred to the paper by Ansel and Gash, but there's also very good work by Kirk Emerson and colleagues. One of the questions that they point to in high-income countries is the success of collaborative governance often depends on the extent to which there is strong local ownership. And I think translating that notion into a more sort of development-oriented context, we need to think more about local ownership of a multisectoral initiative versus more externally imposed initiatives. One paper that we were hoping to publish in the supplement, but unfortunately for various reasons was unable ultimately to be published, was by Peter Kingsley at University of Edinburgh, and was looking at One Health in particular in Uganda, and he and his colleagues have other papers around this issue. And one of the things that they argue was that sometimes One Health, when it was seeking to strengthen institutional arrangements in country to manage this very complex and multisectoral problem, sought sometimes to impose new institutional structures rather than trying to understand what are the existing institutional structures, how well are they working, and maybe it would be better to adjust them, modify them, rather than seeking to entirely, rebuild or impose new ways of doing things. And so I think that for any global level initiative that has a multisectoral focus, this is actually an important lesson about building upon what's already there. The third domain that I was going to talk briefly about was the second domain was around low and middle income country institutions, and this notion of institutions being critical in supporting or undermining multisectoral collaboration. And I think that we're aware that one of the challenges working in a low and middle income country context is frequently we're working with institutions that are relatively weak. And as a consequence of that, they may be likely to choose to focus on their core business rather than what may be perceived to be more diffuse multisectoral efforts. So I guess I'm thinking, of ministries of health when they're already challenged at implementing their core business, namely sort of delivering health services, they may be much more hesitant to go beyond that in terms of trying to exert influence across multiple different sectors. I think one of the other things which is worth observing about many ministries of health and other institutions in low and middle income countries is that they often favor hierarchy, authority, and loyalty over horizontal communication and partnerships. So I guess that we're arguing that often the core stakeholder or stewardship institutions for multisectoral collaboration for health often haven't got the right kind of organizational culture, organizational structures to make them really effective at managing multisectoral collaboration. Further, in many high-income countries, as I suggested earlier, there has over the past 20 years or so been extensive experimentation with new institutional or organizational structures that can better support collaboration across different branches of government. So I'm thinking, for example, of initiatives like policy czars. So as one particular example, the UK government had an obesity policy czar at one point in time. And that policy czar had responsibility for coordinating the different components of different ministerial functions, so including certainly the Department of Health, but also Department of Trade and Industry, Department of Education, with a focus on how do we tackle obesity in the UK. And I think we need to think more about how do we innovate in our organizational arrangements to allow sort of more joined up governance across departments. Another thing that comes out very clearly from case studies of multisectoral collaboration for health in low and middle income countries is that we typically underestimate the resources required to manage multisectoral collaborations. So I think, over the years, we've learned that any collaboration, for example, if we're thinking about how do we coordinate the work of the Global Fund to fight AIDS, TB, and malaria, we have to invest quite heavily in the sort of coordinating committees, the coordinating units for that. But often we start multisectoral collaborations without setting aside sufficient resources to do that, and that's clearly a problem. And then finally, and this comes a little bit back to some of the issues I was mentioning earlier about local ownership, it seems that often in terms of initiatives for multisectoral collaboration, we may rely overly on international consultants who move on, and their extensive networks also move on with them. And also I think there's an issue about the extent to which we have really invested in the skills that individuals need to be able to negotiate across sectors, to manage collaborations across sectors. And I think that that's something, and I sit obviously in the educational sector, working in a university, that's something we need to be thinking more about. How do we train people for this in the future? So the third of the three domains that I was going to talk about was around ideas. And as I said already, I think Ida's done a wonderful job introducing this notion. There are often multiple alternative ways to frame these wicked problems. So on this slide, sort of asking the question, is family planning an issue about women's rights and gender rights, as perhaps indicated on the left-hand picture here? Is it about economic development? Is it about education? Is it about religion? Or indeed, is it about clinical services? So I think for many of the challenges that we're seeking to address through multisectoral collaboration, there are multiple different ways of framing them. And I think it's typically the case that health system actors approach a multisectoral collaboration with the idea that health services are the primary strategy to improve health. And first of all, I think that sometimes rubs people up the wrong way. And also, we did a number of interviews for a piece of work which was trying to define priority research questions around multisectoral collaboration. We heard again and again people from within the health sector say, oh, our colleagues in education need to understand the evidence better. They need to understand the health evidence better. Or our colleagues in trade and industry need to understand the health evidence better. And I think that there's a number of challenges to this. I mean, clearly, people in other sectors don't have health as their primary focus. So we need to find framings that maximize the shared ground, maximize the reasons why people in education may be incentivized to collaborate with us. And also sometimes, as I've already said, we need to recognize that there may be competing interests. So in the last couple of slides of my presentation, I wanted to reflect a little bit upon, I guess, what we learned from this work on a supplement on multisectoral governance for health and where it might take us in the future. And I'm going to draw on a couple of different papers for this. Firstly, Kuman and Rasanathan lead authored one of the final papers in the supplement, which was around strategies for moving forward. And this is just a high-level summary of the main lessons that are presented in that supplement. First of all, we think that we need to be much more strategic when we're approaching multisectoral collaborations for health. We need to start out by mapping the key actors, better understanding the political context, and allowing that understanding of those factors, as well as the nature of the multisectoral action required and our understanding of interests and institutions, to help us plan and develop a strategy and approach for the multisectoral collaboration. Secondly, and as Ida, I think, has already alluded to, we need to frame the issue in the most strategic manner possible. Frequently, that won't be a health sector framing of what we need to do. And we're likely to need to use different framings for different audiences. So if we're talking to someone from education, we may use one approach for saying why this is a really important issue. If we're talking to someone who comes from trade, we need to have a different type of strategy. It's important to have clearly defined roles and specific interventions for different sectors so that different sectors can understand exactly what they're being asked to do and can recognize the relevance of that ask to their own particular mandate. As I alluded to in my example from One Health, we think that there's a strong argument for using existing structures where possible, rather than imposing new structures on what already exists. We need to pay very explicit attention to the role of non-state sectors. I haven't talked very much about this in this particular presentation, but it's clear that multisectoral collaboration and multisectoral governance for health often involves private sector actors, and we need to think very carefully about what they're bringing to the table, the extent to which their interests are aligned with the issue that we're trying to take forward versus being in competition. And where there are conflicts of interest, we need to give particular attention to how do we manage those. I talked a little bit about this notion of political leadership being key, but actually one of the points that we make in the supplement is that leadership can be distributed across the sector and across different organizations across different sectors. So we don't want to depend just upon one or two high-level political leaders. We need to think about how we can encourage and nurture leadership at multiple different levels. We need to develop financing and monitoring systems that encourage collaboration, and we need to strengthen implementation processes and capacity, as well as continuing to support mutual learning and implementation research. And on that final topic of mutual learning and implementation research, there is a paper in the supplement that is really about what's trying to set the research agenda for multisectoral collaboration for health. And this was co-authored by a colleague of mine, or lead authored by a colleague of mine, Doug Glandon, and we're actually having a webinar about it on the 20th of November, talking about what's the research agenda here. And as you can see from the top 5 priorities that came out of that process, a lot of what policymakers are asking for is the kind of the practicalities, the hows of how do we manage and better support multisectoral collaboration for health. And these top 5 questions also highlight this issue of evidence and about how different evidence, how evidence needs differ across different sectors. This is priority number 3. And how can we make health evidence more understandable and more accessible to those in other sectors? So this is my final slide, and it's really just trying to make the sort of big picture ask here. Our supplement clearly was not focused on maternal, neonatal, and child health, but I think many of the lessons that come out of it are relevant to maternal, neonatal, and child health. But more broadly, in the SDG era, I think we really need to invest in capacity, and by that I mean skills, organizational capabilities, and systems that can facilitate and support the governance of multisectoral collaborations for health across multiple different health domains. Thank you very much indeed. I guess I should hand back to Maureen.
I'm sure all the participants would like me to thank all our speakers on their behalf. First, Rachel, for giving us an idea of how the case studies were selected, and that makes us look forward to them being released at the PMNCH meeting. And for Ida on her research on the first 1,000 days and how multisectoral collaboration was achieved, some of its strengths, some of its challenges, and for Sarah, who took us through the governance approach. We have a question, and one of our participants has asked about the role of the family. The family has often been excluded in most of the shared values and the tasks being carried by social media, school, hospital, and peers. How can we better get the family to integrate in this collaborative process? I'm going to ask our speakers to respond, each in the order in which they spoke. How can we get the family involved? Rachel?
It's an excellent question. I think Ida in particular, I think, given the 1,000 days kind of presentation, will have probably very interesting insights here as well. But I think in all of these approaches and work that we do, the participatory approaches that enable the family and communities and those who are actually the beneficiaries of many of these multisectorial collaborations need to be engaged from the outset. And this is an issue that we face in many of our implementing the policies and programs that we do, and the approaches that are required to facilitate the participation of families and communities in both the collaboration themselves, but also in the monitoring and evaluation of the collaboration and the programs, etc., is vital. But I'd certainly like to hear from Ida on this, particularly given the focus of her research, and if this point specifically did come up in the work in terms of the framing of the issue, and if families were involved in these discussions as well.
Okay, Ida, let's hear from you.
Thanks, Rachel. So the First 1,000 Days initiative in its entirety requires that families get involved, or that communities are engaged in one way or another, especially because parenting occurs mainly in the home setting, and that often is navigated by families or parents themselves. And so that is a broad idea that the First 1,000 Days wanted to accomplish. But often I think in policy processes, a lot of the talk during formulation normally occurs in sort of the bureaucratic systems, and in the settings where the implementation strategies are discussed, often there isn't engagement with families or communities in general. And I think that needs to shift, because often right after the policy is formulated, it then needs to trickle down to the family or to the community level. But there's a disconnect when they weren't engaged from the very beginning. So one of the spin-offs of the first 1,000 days is this whole of society approach that the Western Cape government has been involved with. And I think one of the recognitions of the whole society approach is that community engagement is at the core or at the heart of the process. And so the way government sectors as a whole relate to communities has shifted the way the government sectors as a whole relate to communities. So in that approach, there's a much more systematic way of trying to engage citizens, trying to understand the lived experiences of community members in particular settings, and trying to reduce the notion that policies are made for communities, but should rather be a process where communities are involved in engaging with what they need and what works for them. Thank you.
Okay, Sarah, we would like to have your impressions of the engagement of the family.
No, it's a great question, because obviously when you get to the family level, these sectors don't exist. I mean, families and households are not thinking, oh, this is an education issue and this is a health issue. It's all sort of joined up in a complex web. I think Ida's actually made some of the key points already, that we need to find ways for our health systems to better listen to and integrate communities, because I think that to the extent that we hear their voice and act upon their voice, it's going to compel more integrated and people-centered services. So I think that that's a large part of what the questioner was asking about. How can we really shift our health systems to more people-centered and integrated approaches? And obviously WHO does have a strategy around how to do that, which talks quite explicitly about different ways of better empowering people within the health system, as well as sort of integrating them. And I'd be happy to share the link to that strategy if that would help. I can try and find it now.
Okay, we have another question that's really, I think, Sarah, we're going to start with you this time. Asha has stated that we've identified really great research priorities. And she wants to know, and on behalf of the other presenters, what research do we need next, and who is best slated to do this research?
Thank you. I mean, I honestly think that this is a really wide open area for research, particularly in the context of low and middle income countries. I feel that we've had a lot of different initiatives to understand multisectoral collaboration for health, but there's perhaps much more we can do in terms of developing the tools in our research toolbox to do that. So developing new approaches, and I think that Ida's example of a more sort of policy analysis of how do multisectoral collaborations for health get initiated, and different framings of them is one way of coming at that. Doug Glandon, whose work I spoke about earlier, is actually in India looking at the integrated child development program there, and looking at how frontline health workers and nutrition workers collaborate or not, and trying to understand what were the factors that were influencing the extent of their collaboration. So the paper, which Doug Glandon lead authored, has a sort of long list of research questions, which in ways is a little bit dispiriting to see all of those there. But I do think that, compared to the work that we have done in other domains, multisectoral collaboration has been very much neglected. In terms of how that work should get done and who should do it, I think that the closer to the ground, in the sense that the more this work is led by people within the countries who really understand the political contexts and the dynamics, the better that is. But also I do think that we need to make sure that this is truly multidisciplinary. And I think that there are really important theories, frameworks, and expertise from people who don't typically sit in health sector institutions or schools of public health. So I'm thinking in particular of sort of schools of public administration, potentially political science, but largely public administration, I would say, that I think we need to draw upon and draw in much more to the research that we do. Thank you.
Okay, do one of the presenters wish to add to that before we take another question?
If I may, Maureen, just to add to that, this is Rachel. I think it's extremely interesting, and I think one of the interesting things that was coming out of the discussions of the multisectoral collaboration study series is also discussions around how, you know, learning from things that didn't work, as well as what worked, and around adapting to the challenges that were faced. I think, you know, trying to look at some of the ongoing challenges that evolve across the multisectoral collaboration, and learning from that, but also what didn't work, and how we don't necessarily, you know, reinvent the wheel all the time in terms of, you know, we'll do this, we'll do that, when actually in some cases it hasn't worked. And it would be good to learn from what didn't work, and maybe it might work in another setting, but just to sort of have an environment for opportunities around that sort of focus as well, I think would be of use.
Thanks for that, Rachel. Yes, we often focus on what works and not enough on what doesn't work. Thank you for highlighting that for us. If you look in your chat box, you'll see that the WHO framework on the Integrated People-Centered Health Services link has been put up by Ashen. We now have another question, which is about sustainability. All of us have worked in systems where a new project comes up and it's great and it works for as long as the project is funded. What happens now with multisectoral collaboration? How do we ensure sustainability? Ida, would you like to start to let us know what you found in your work on the 1,000 days?
So I think that you're right. Often multisectoral interventions start out as a really good idea, and there's a wide variety of people who are interested in seeing it going forward, but then it's either a short project that ends, or it kind of just falls off on the wayside. So I think for sustainability, it's important for us to consider the ability of systems that are already in place, and trying to engage with or trying to ensure that government sectors that are already working in that particular area are capacitated to continue forward with the initiatives or the projects. So I think there is a need to recognize that the people who work in those particular settings that we are trying to change, so the people involved in the government sector or in whichever setting that is involved in, we have to try and build their capacity, or just have a more principled engagement process among sectors, as opposed to bringing ideas that get reinvented over and over again. But there's a need to work with those who are working in that particular system and try and enable the sustainability in terms of them being able to engage with multisectoral ideas or initiatives. But what I found quite interesting in the 1,000 days was the fact that everybody agrees across sectors that it's quite important, and that they want it to go on to implementation. But actually, the core part that leads to sustainability, I think, is the conversation between different sectors, the navigation of interests. So I really think that engagement processes are quite crucial in terms of sustainability, and just ensuring that we continue to work with those in the system who are able to create the change that we require. Thanks.
Okay, Rachel, anything to add?
Sure, no, I mean, I 100% agree with Ida, and also drawing on the point Sarah made around investing in the mechanisms and of the collaboration itself is hugely important, and just echoing what Ida said. But also, it's really a sort of a process of adaptability and learning by doing, and sort of very much having a feedback mechanisms in place as well, I think, to be able to see perhaps where things aren't going right or going as well to plan, to have the potential or the opportunity or the openness to change. I think it's important for sustainability as well, and building on the existing structures that are there, but being able to be adaptive and innovative and responsive to change, I think, is another point to raise there.
Thank you. We have another question, which I think I'm going to ask Sarah to answer. One of our participants has stated that in their country, they have had multisectoral collaboration initiatives on issues like ending child marriages and teenage pregnancies, but they have been proposed by external persons, probably international development partners. However, they have developed strategic plans and other related documents. But then once they do this, it doesn't get funded by the sectors who are meant to implement the plans, probably because they have different priorities, and so they are included in plans, but they remain on paper. How can this be addressed?
Thank you very much, Maureen, and thank you to Samuel, I guess, for sending in the question. I mean, I guess the problem that you're pointing to, Samuel, is not one that is specific to multisectoral collaborations. We see the same phenomenon with other types of development initiatives where there's not true local ownership of the initiative. But I think that for multisectoral collaborations, the challenge is perhaps even greater in the sense that there's a broader network of stakeholders and typically sort of multiple different government departments that need to buy into the proposed initiative. In my view, I guess the question and the challenge that you've observed really underscores the importance of building the necessary policy coalitions in order to make something like this happen. So I think that if we focus just on getting the plan approved and the sort of rubber stamping of that without building the stakeholder base, and I think that there's a webinar later in this series which is really around building political commitment, but I think that that's key for multisectoral collaboration. And for initiatives of this sort which are reaching across sectors, our coalition building also needs to reach across sectors and to build those networks, because often the networks don't really exist there to start with. So there may be, advocates working in the education sector, advocates working in the health sector, but the networks linking them and enabling them to coordinate their work may not already exist. I think that's all I have to say, actually.
And I'm going to throw this question to you as well, Rachel. You've had the experience of, reviewing lots of different papers from across the world. How has this problem been addressed?
No, I mean, I absolutely agree with Sarah's comments as well. I think 100% that it's certainly not a problem related to multisectoral collaboration. And yes, I think importantly, it's about, when one has seen a project that started very much at the local level and was able to sort of turn from a community-driven and led project right up to one that is to be transitioned to ownership to the Ministry of Health, which is quite phenomenal, but at the same time that allowing that other ministries and other partners to get on board and to be part of that process as well. It can't come at the end. It very much needs to sort of be thought through and discussed and envisioned early on. Although sometimes it's difficult when it is a smaller project that does get bigger. So I think having these ideas and strategies early on, very much around the time that Ida's presentation was talking about, as well as what Sarah raised, I think is important to this as well.
All right, thank you. I am going to just thank all our speakers now. Thank you, Rachel, Ida, and Sarah, for all your presentations that have given us all so much information. And thank you for your responses to the questions, which have allowed us a little deeper dive into the areas in which you have researched. I am now going to hand over to Sheila for next steps and announcements.
Wonderful. Thank you, Maureen, and thank you to Rachel, Ida, and Sarah for your presentations, and to all of you for being with us today. Thank you for the questions also. Just so you know, we will be uploading the presentation, the webinar recording, and also the resources that were shared in the chat today. You'll find those on the website in the next few days. On the screen, you'll see our vision and mission for the Virtual Partners Forum. And though the webinar series is organized by us and through the plenary groups, we hope that this will be a dialogue with all of you, and that you will find ways to contribute to this, so that it's coming from us and also coming from you. So earlier I mentioned the virtual side events as an option for all of you to think about ways that you can raise questions, generate ideas, and generate a conversation before and during the Partners Forum. Some of what you heard today will be presented at the Partners Forum, but there will be much, much, much more, because each of the themes has a plenary and 6 concurrent sessions. So those of you that were asking for more concrete examples, that will certainly be there at the forum. So if you're interested in finding out more about what's going to be happening around the Virtual Partner Forum, or around the Partners Forum in general, these are the Twitter hashtags and websites and things to be paying attention to. You will get an announcement in the next day letting you know about the webinars that are next week, on November 19th on the theme of accountability, and on November 20th on the power of partnership. You do not need to register again. You will get information automatically. And again, do check in at partnersforum2018.com for more information. And thank you once again to our plenary co-chairs, to Asha and to Maureen, and to our speakers today for getting the ball rolling with the Virtual Partners Forum. And we look forward to seeing you again here and seeing you again online in the next few weeks. And take care, everyone. Thank you. Goodbye.
Thank you very much.
Thank you all. Talk to you soon.
Thank you.
Everyone.